हेलो। गुड इवनिंग ऋषि, अजीत, बलराम। दिस इज ए माइक चेक। सायदा, कार्तिक। हेलो ऑल ऑफ यू। गुड इवनिंग ऑल ऑफ यू। टुडेस टॉपिक ऑफ डिस्कशन इज रेगुलेशन ऑफ एंजाइम एक्टिविटी। अब तक हमने क्या क्या देखा? मुझे तो लगता है आपको याद हो गया होगा हमने क्या क्या लर्न किया, क्योंकि हमने इतने टाइम उसको रिवाइज भी किया। तो जितने भी एलएक्यूज है के इम्पोर्टेंट पॉइंट्स आपको अभी तक याद होने चाहिए। ठीक है, अगर आपको याद नहीं हुए हैं तो जस्ट राइट डाउन करो, उसको उसको लिख के देखो, है ना। हमने पहला इंपॉर्टेंट एलएक्यू डिस्कस किया था, क्लासिफिकेशन ऑफ एंजाइम, मॉडर्न क्लासिफिकेशन ऑफ एंजाइम या क्लासिफिकेशन ऑफ एंजाइम ऑन द बेसिस ऑफ देयर commission number, enzyme commission number, or on the basis of reaction catalyze, that is OTH-LILT. OTH-LILT, this is the classification of enzyme with suitable example। ये चैप्टर का इंपॉर्टेंट एलएक्यू है एंजाइम टॉपिक का। फिर दूसरा इंपॉर्टेंट एलएक्यू है एंजाइम इनिबिशन। एंजाइम इनिबिशन जिसमें कॉम्पिटिटिव, नॉन कॉम्पिटिटिव, अनकॉम्पिटिटिव, देन इरिवर्सिबल, सुसाइड इनिबिशन, फीडबैक इनिबिशन, इसके सारे हमने विथ एग्जांपल हमने डिस्कस किए, उसके ग्राफ भी डिस्कस किए। फिर डिफरेंट फैक्टर्स अफेक्टिंग एंजाइम एक्टिविटी, मतलब एंजाइम वेलोसिटी और एंजाइम एक्टिविटी, मतलब नंबर ऑफ सबस्ट्रेट मॉलिक्यूल्स टर्न इनटू द प्रोडक्ट इनटू यूनिट टाइम। उसमें हमने देखा सबस्ट्रेट कॉन्सेंट्रेशन, प्रोडक्ट कॉन्सेंट्रेशन, then enzyme concentration, effect of pH, effect of temperature, effect of metal activators and effect of different inhibitors। तो ये तीन इंपॉर्टेंट एलएक्यू हमने डिस्कस किए। क्लासिफिकेशन ऑफ एंजाइम विद सुटेबल एग्जांपल, दूसरा फैक्टर अफेक्टिंग एंजाइम एक्टिविटी, तीसरा एंजाइम इनिबिशन, और चौथा इंपॉर्टेंट जो हमने प्रीवियस क्लास में डिस्कस किया, दैट इज आइसोएंजाइम्स एंड डायग्नोस्टिक यूजेस ऑफ एंजाइम्स। जस्ट वेट, आइसोएंजाइम एंड डायग्नोस्टिक यूजेस ऑफ एंजाइम, ये हमने डिस्कस किया। ठीक है, तो ये सारे क्वेश्चंस हमने डिस्कस किए। चार इंपॉर्टेंट एलएक्यूज है इससे रिलेटेड, चार इंपॉर्टेंट एलएक्यूज हो गए। फिर इसके साथ साथ हमने कोएंजाइम डिस्कस किया, मतलब आइसोएंजाइम एसएक्यू डिस्कस किया, है ना। तो डिफरेंट थियरीज रिलेटेड विथ एंजाइम सबस्ट्रेट कॉम्प्लेक्स फॉर्मेशन हमने डिस्कस किया। तो इसके साथ साथ छोटे छोटे शॉर्ट नोट्स है और क्लिनिकल केसेस है। कुछ कुछ यूनिवर्सिटी में क्लिनिकल केसेस एज ए एलएक्यू पूछे जाते हैं, लॉन्ग आंसर क्वेश्चंस। तो एंजाइम चैप्टर में चार इंपॉर्टेंट केसेस है, क्लिनिकल केसेस। कौन कौन से चार इंपॉर्टेंट क्लिनिकल केसेस है? पहला, एक्यूट मायोकार्डियल इन्फार्क्शन, जिसमें चेस्ट पेन और ईसीजी चेंजेस रहेंगे, जिसको हम लेमन टर्म में हार्ट अटैक बोलते हैं। ठीक है, एक्यूट मायोकार्डियल इन्फार्क्शन, ये एक इंपॉर्टेंट एलएक्यू है अलोंग विद द कार्डियक मार्कर्स। सभी यूनिवर्सिटी में क्लिनिकल केस एज ए एलएक्यू नहीं पूछते, लेकिन कुछ यूनिवर्सिटीज ऐसी है जिसमें एलएक्यू क्लिनिकल केस रहती है। ठीक है, so this is acute myocardial infarction along with the cardiac markers, this is important LAQ। second important clinical case is viral hepatitis, viral hepatitis and different enzymes in viral hepatitis, this is also important LAQ because it is a overlapping topic with LFT, liver function test, it is overlapping topic with the hemoglobin metabolism। So this is also very very important clinical case, viral hepatitis and obstructive jaundice। तो तीन क्लिनिकल केसेस देखो, एक्यूट मायोकार्डियल इन्फॉक्शन, वायरल हेपेटाइटिस मतलब हिपेटोसेलुलर जॉन्डिस, और तीसरा ऑब्स्ट्रक्टिव जॉन्डिस। ये तीन इंपॉर्टेंट केसेस है, फॉलोड बाय पैनक्रेटाइटिस, एक्यूट पैनक्रेटाइटिस, जिसमें एब्डोमिनल पेन रहेगा और अमाइलेज और लाइपेज की लेवल बढ़ी हुई रहेंगी, सीरम अमाइलेज सीरम लाइपेज लेवल बढ़ी हुई रहेंगी, उसको बोलते हैं पैनक्रेटाइटिस। ये हो गए चार इंपॉर्टेंट क्लिनिकल केसेस ये चैप्टर में से। और दो इंपॉर्टेंट क्लिनिकल टॉपिक, जैसे थेराप्यूटिक यूजेस ऑफ कॉम्पिटिटिव इनिबिटर्स। जैसे हमने कॉम्पिटिटिव इनिबिशन देखा, ये कॉम्पिटिटिव इनिबिटर्स जो है बहुत सारे डिसीजेस में एज ए थेराप्यूटिक ड्रग, मतलब ट्रीटमेंट में उसको हम यूज करते हैं, तो वो भी क्लिनिकल टॉपिक है। इट इज नॉट नेसेसरी कि क्लिनिकल केस ही आपको पूछा जाएगा, क्लिनिकल टॉपिक भी आपको पूछा जा सकता है। उसमें इंपॉर्टेंट है स्टैटिन्स, लोवेस्टैटिन, सिम्वेस्टैटिन, अटोरवेस्टैटिन, है ना। स्टैटिन्स इंपॉर्टेंट है। सो स्टैटिन्स इनिबिट एचएमजी कोएंजाइम रिडक्टेज, ओके, एंड रिड्यूसेस द कोलेस्ट्रॉल लेवल, ये एक हो गया। और दूसरा है सुसाइड इनिबिशन, जिसका एग्जांपल है अलोप्यूरिनॉल। अलोप्यूरिनॉल इज द ड्रग विच इज यूज इन द ट्रीटमेंट ऑफ gout. Gout means there is involvement of first metatarsophalangeal joint, which is a most common site for the gout, uh, due to defect in the purine nucleotide metabolism, purine nucleotide catabolism, that is uric acid. There is increased production of uric acid and monosodium urate crystals deposited in the joint. First metatarsophalangeal joint is involved. तो मैंने 6 इंपॉर्टेंट पॉइंट्स यहाँ पे क्लिनिकल बोला है। जो यूनिवर्सिटी में क्लिनिकल केस एज ए एलएक्यू पूछा जाता है, उनके लिए ये 6 के 6 टॉपिक इंपॉर्टेंट है। कौन कौन से 6 टॉपिक बोला मैंने? ये तो हम आज देखने वाले हैं। रेगुलेशन ऑफ एंजाइम एक्टिविटी, इसमें 2 इंपॉर्टेंट एसएक्यूज है, और ये 2 इंपॉर्टेंट एसएक्यू अगर आपने प्रिपेयर किए तो यू कैन राइट द एलएक्यू, दैट इज रेगुलेशन ऑफ एंजाइम एक्टिविटी। जस्ट वेट। तो दिस इज इंपॉर्टेंट क्लिनिकल केस, मायोकार्डियल इन्फार्क्शन। मायोकार्डियल इन्फार्क्शन मतलब क्या होता है? बिकॉज ऑफ नैरोविंग ऑफ द ल्यूमेन ऑफ द आर्टरीज, जो हार्ट को ब्लड सप्लाई कर रही है, वो जो आर्टरीज है उसका ल्यूमेन बिकॉज ऑफ एथरोस्क्लेरोसिस और बिकॉज ऑफ वासोस्पाज्म, उसके वजह से अगर वो ऑब्स्ट्रक्ट हो गई, करोनरी आर्टरी जो हार्ट को ब्लड सप्लाई करती है, तो हार्ट के कुछ रीजन को ब्लड सप्लाई नहीं होगा या कम होगा, दैट कॉजेस इश्केमिया, मतलब इसकी इश्केमिया होगा, और उसके वजह से नेक्रोसिस या डैमेज, जो भी पेन होगा, टिश्यू पेन, दैट इज सीवियर, severe pain, chest pain. This is a symptom of myocardial infarction, acute myocardial infarction, chest pain. और उस एरिया को ब्लड सप्लाई नहीं होने की वजह से वो टिश्यू डैमेज हो जाएगा, नेक्रोज हो जाएगा। तो ऑल्सो देर इज ईसीजी चेंजेस, इलेक्ट्रोकार्डियोग्राम चेंजेस in the form of ST elevation, T wave inversion, depending upon the part of the heart involved. So acute myocardial infarction along with the different biomarkers, means markers which increases in the acute myocardial infarction, मतलब ब्लड में जो जो लेवल बढ़ जाती है, जिस जिस पैरामीटर की, एंजाइम अलोंग विद द प्रोटीन्स, एंजाइम कौन कौन से बढ़ते हैं एक्यूट मायोकार्डियल इन्फेक्शन में? CKMB, क्रिएटिन फॉस्फोकाइनेज MB आइसोएंजाइम, और CK2, क्रिएटिन काइनेज 2। ये हो गया कार्डियक मार्कर। अर्लीस्ट एंजाइमेटिक स्पेसिफिक कार्डियक मार्कर इज द CKMB। देन कुछ ट्रोपोनिन्स जो है वो स्पेसिफिक है डायग्नोसिस के लिए, और वो बेडसाइड टेस्ट भी उसके साथ हम कर सकते हैं, दैट इज ट्रोपोनिन आई एंड ट्रोपोनिन टी। दीज आर द स्पेसिफिक एंड अर्ली मार्कर फॉर द diagnosis of acute myocardial infarction. Along with this, LDH1, दैट इज फ्लिप्ड पैटर्न ऑफ एलडीएच, मतलब नॉर्मली LDH2 का कॉन्सेंट्रेशन ज्यादा रहता है, लेकिन एक्यूट मायोकार्डियल इन्फेक्शन में LDH1 का कॉन्सेंट्रेशन LDH2 से ज्यादा हो जाता, दैट इज नोन एज फ्लिप्ड पैटर्न ऑफ LDH, विच इज सीन इन एक्यूट मायोकार्डियल इन्फेक्शन। सो लैक्टेट डिहाइड्रोजनेज 1 आइसोएंजाइम, okay, and SGOT, these are the late markers of myocardial infarction. Apart from this, there are some new markers also. So acute myocardial infarction is an important LAQ, acute myocardial infarction, कुछ यूनिवर्सिटीज में जहाँ पे LAQ क्लिनिकल केस रहती है। बाकी लोगों के लिए ये एज ए क्लिनिकल केस और एज ए शॉर्ट नोट कार्डियक मार्कर इंपॉर्टेंट है। रिमेंबर, चेस्ट पेन बोला और डायग्नोसिस अगर आपको पूछा है तो गो विद द एक्यूट मायोकार्डियल इन्फेक्शन, क्योंकि ऐसा बाकी कोई डिसीज नहीं है जिसमें चेस्ट पेन होता है बायोकेमिस्ट्री से रिलेटेड। ओके, वायरल हिपेटाइटिस एंड ऑब्स्ट्रक्टिव जॉन्डिस, दिस इज हिपेटोसेलुलर जॉन्डिस, दिस इज ऑब्स्ट्रक्टिव जॉन्डिस। हिपेटोसेलुलर जॉन्डिस मतलब लीवर पैरेन्काइमल सेल इन्वॉल्व है, उसके वजह से उसमें जो स्पेसिफिक एंजाइम्स है, कौन से स्पेसिफिक एंजाइम्स है? SGOT, SGPT, उसका लेवल बढ़ा हुआ है। ठीक है, यहाँ पे CKMB आपको बढ़ा हुआ बताएंगे, CK2 और CKMB आइसोएंजाइम। देन वेरियस ट्रोपोनिन्स, ट्रोपोनिन I एंड ट्रोपोनिन T, ट्रोपोनिन ट्रोपोनिन I, ट्रोप I एंड ट्रोप T लेवल्स बढ़ा हुआ रहेगा। ठीक है, और चेस्ट पेन ECG चेंजेस, तो इसमें वो थ्रोम्बोलिटिक एजेंट्स हम यूज करते हैं, यूरोकाइनेस, स्ट्रेप्टोकाइनेस, और टिश्यू प्लास्मिनोजन एक्टिवेटर जो कि यूजेस ऑफ एंजाइम में भी आते हैं। इन्यूमरेट 4 थेराप्यूटिक यूजेस ऑफ एंजाइम, उसमें स्ट्रेप्टोकाइनेज यूरोकाइनेज हम यूज करते हैं ट्रीटमेंट में। एक्यूट मायोकार्डियल इन्फार्क्शन फॉर लाइसिस ऑफ द ब्लड क्लॉट, जो क्लॉट हो गया उसके लाइसिस के लिए हम यूज करते हैं। अगर हमने अर्ली डायग्नोसिस किया तो वो क्लॉट जो है हम थ्रोम्बोलिटिक एजेंट के साथ हम रिमूव कर सकते हैं। दैट्स वाई इट इज इंपॉर्टेंट टू डायग्नोस मायोकार्डियल इन्फार्क्शन एट अर्ली स्टेज। ठीक है, ये एक एलएक्यू है और एसएक्यू भी है और क्लिनिकल केस है। दूसरा इंपॉर्टेंट है वायरल हिपेटाइटिस मींस हिपेटोसेलुलर जॉन्डिस। हियर लीवर पैरेन्काइमल सेल्स आर इन्वॉल्व, liver parenchymal cells are involved, so there is increase in the sgpt level. There is increase in the sgpt level, means another name is alt, alanine transaminase. Also there is increase in the sgot level. So SGOT, SGPT level, there is marked increase in SGOT and SGPT level in viral hepatitis or hepatocellular jaundice. Along with there is slight 2 to 3 time increase in the alkaline phosphatase level, 2 to 3 times of the normal. Okay, in viral hepatitis. And in viral hepatitis, both type of bilirubin means bilirubin, that is direct and indirect, both type of bilirubin increased in viral hepatitis. So remember this, the Vandenberg reaction, matlab principle of bilirubin estimation. That is biphasic. Biphasic matlab it is positive for direct bilirubin, positive for indirect bilirubin. And also there is increase in the SGPT, SGOT and alkaline phosphatase level, but slight increase in the alkaline phosphate levels, not marked increase in the alkaline phosphatase level. Viral hepatitis, specifically the viral infection which causes the uh, hepatic disease, that is viral hepatitis or hepatocellular jaundice or hepatic jaundice. देन ऑब्स्ट्रक्टिव जॉन्डिस, ये जो है ऑब्स्ट्रक्टिव जॉन्डिस में क्या रहता, हियर देर इज ऑब्स्ट्रक्शन टू द फ्लो ऑफ बाइल, ऑब्स्ट्रक्शन टू द फ्लो ऑफ बाइल बिकॉज ऑफ कार्सिनोमा ऑफ हेड ऑफ पैनक्रियाज और ऑब्स्ट्रक्शन ऑफ कॉमन बाइल डक्ट, इसमें से बाइल फ्लो होके इंटेस्टाइन में जाता है। तो यहाँ पे अगर ब्लॉक हो गया तो देर इज इंक्रीज इन द obstructive enzymes that includes alkaline phosphatase, 5 prime nucleotidase, gamma glutamyl transferase, इनकी लेवल जो है वो मार्क इंक्रीज हो जाती। अल्कलाइन फॉस्फेटेज, 5 प्राइम न्यूक्लियोटाइडेज, gamma glutamyl transferase, and there is slight increase in the SGPT and SGOT level, SGPT SGOT लेवल, लेकिन इतना नहीं बढ़ेगा जितना यहाँ पे बढ़ा हुआ है वायरल हेपेटाइटिस में, 1000 1500 2000 मतलब यहाँ तक चला जाता। इसमें स्लाइट इंक्रीज इन द एसजीओटी एसजीपीटी लेवल, देन मार्क इंक्रीज इन द अल्कलाइन फॉस्फेटेज, 5 प्राइम न्यूक्लियोटाइडेज, gamma glutamyl transferase level. Here the type of bilirubin is direct bilirubin, increase in the direct bilirubin, means Vandenberg reaction here is direct positive, direct positive मतलब immediate color आता है इसलिए उसको बोलते हैं direct positive. Okay, so bilirubin increase, direct bilirubin, alkaline phosphatase, 5 prime nucleotidase, GGT levels marked increase, and SGPT SGOT levels slight increase in the obstructive jaundice causes carcinoma of head of pancreas which obstruct the common bile duct. Also the stone stricture tumor tuberculosis of the common bile duct that causes obstruction to the flow of bile. Okay, and as ALP is the ectoenzyme present on the surface of biliary epithelium, when there is obstruction to the flow of bile, it regurgitates and causes the release of ALP and it leaks out into the plasma. That's why there is increased ALP level. And pancreatitis, there is pain in abdomen. So symptom is pain in abdomen, severe pain in abdomen. There is increase in the serum amylase level and increase in the serum lipase level. When there is when these levels are raised, amylase and lipase levels are raised, and there is pain in abdomen, it indicates the pancreatitis, acute pancreatitis. Got it? So these are the key features of these 4 important disorders. Key features of 4 important disorders. और एंजाइम में ये 4 important diseases है. Acute myocardial infarction, viral hepatitis or hepatocellular jaundice or hepatic jaundice, then post-hepatic jaundice or obstructive jaundice, and pancreatitis. These are the 4 important cases from the enzyme topic. The next important or clinically important topic is gout. is gout. There are two types, primary and secondary gout. We will learn this gout in the purine nucleotide catabolism. Okay. So in purine nucleotide catabolism, there is synthesis of uric acid. There is synthesis of uric acid. So this AMP, so AMP, GMP, these are converted into uric acid through various intermediates. It is converted into uric acid. And when uric acid concentration goes above 7, it started precipitating in the joints, and most commonly affected joint is the first metatarsophalangeal joint, matlab joint of the great toe. It is most commonly involved in the gout. Okay, great toe, that is first MTP, metatarsophalangeal joint. It is most commonly involved in the gout. There is deposition of monosodium urate crystals in the joint. So it is because of excess of uric acid production, the purine nucleotide degradation. Okay, pathway, excess of uric acid production. Now, to lower the uric acid, we use the drug allopurinol. This is connected with the enzyme. Allopurinol, it is a drug, purinol. It is given in the treatment. So it acts by two mechanism. One is the competitive mechanism, competitive inhibition, and second is the सुसाइड इनिबिशन. इसीलिए ये एंजाइम में आने के चांसेस है, क्योंकि ये ओवरलैपिंग टॉपिक है, इंटीग्रेटेड टॉपिक है. तो अलोप्यूरिनॉल, इट इज ए ड्रग, इट इज एन कॉम्पिटिटिव इनिबिटर ऑफ xanthine oxidase enzyme. So xanthine oxidase, it is in the uric acid metabolism. It converts hypoxanthine to xanthine, xanthine to uric acid. So this allopurinol, see now, hypoxanthine to xanthine and xanthine to uric acid is caused by xanthine oxidase enzyme. Xanthine oxidase enzyme. It is converted by xanthine oxidase enzyme. Allopurinol is the drug which is competitive inhibitor of xanthine oxidase. It is structurally similar to that of hypoxanthine and inhibit the uric acid production. Also, it is suicide inhibitor. Allopurinol is converted into alloxanthine by the xanthine oxidase itself, and alloxanthine is the more potent inhibitor of xanthine oxidase. So, by these two mechanisms, means competitive inhibition and suicide inhibition, allopurinol decreases the uric acid level. So it is used in the treatment of gout. So remember, this is also an important LAQ as a clinical case LAQ, or you may get clinical case or short note on this topic. कौन से? Allopurinol as a therapeutic drug or therapeutic uses of competitive inhibition. The next important topic from this is the statins, uses of statin. Now statin C, acetyl coenzyme A. In the cholesterol synthesis, two molecules of acetyl coenzyme A, it forms acetoacetyl coenzyme A. And when it combines with the third molecule, it combines with the third molecule of acetyl coenzyme A, it forms hydroxymethyl glutaryl coenzyme A, that is HMG coenzyme A. Now HMG coenzyme A reductase converts HMG coenzyme into mevalonate, and mevalonate is converted into, through various steps, it is converted into cholesterol. तो यहाँ पे कंप्लीट कोलेस्ट्रॉल पाथवे निकालने की जरूरत नहीं है, अगर पाथवे पूछा है तो ही लिखना है. तो HMG कोएंजाइम ए reductase, this is rate limiting enzyme in the cholesterol biosynthesis, and it is inhibited by the drug that is known as statins. So name of the drug is lovastatin, simvastatin, atorvastatin, rosuvastatin, जो भी है ब्रांड नेम कुछ भी रह सकता है. तो ये जो मॉलिक्यूल है स्टैटिन्स, मतलब ये जो स्टैटिन्स है, ये कोलेस्ट्रॉल डिक्रीजिंग एजेंट्स है, कोलेस्ट्रॉल के लेवल कम करते हैं, है ना. तो ये जो है एथेरोस्क्लेरोसिस में, या जहाँ पे हाइपरलिपिडेमिया है, जहाँ पे कोरोनरी आर्टरी डिसीजेस का पेशेंट है जिसमें एथेरोस्क्लेरोसिस है, उसको ये प्रिस्क्राइब करते हैं टू रिड्यूस द कोलेस्ट्रॉल लेवल. ओके, नाउ स्टैटिन्स inhibit the HMG coenzyme A reductase by competitive inhibition. The statins are structurally similar to that HMG coenzyme A, and it competes for the active site of an enzyme HMG coenzyme A reductase and decreases the cholesterol level. तो ये एक important clinical question है यहाँ पे. So remember these 6 topics. These are very very important as clinical case, as a clinical case LAQ for some universities. It is important as a short note It is important as a clinical case short note. Okay, so these are the important topic. Now see this cases. आप ये cases देखो, आप identify करने की कोशिश करो. A 55-year-old executive reported with severe chest pain was admitted to the hospital. Severe chest pain. See, सीवियर चेस्ट पेन, मैंने बोला चेस्ट पेन बोला है, और डायग्नोसिस अगर आपको पूछा है तो गो विथ एक्यूट मायोकार्डियल इन्फेक्शन टू द हॉस्पिटल. इन्वेस्टिगेशन शोड ईसीजी चेंजेस and block in the artery, and his laboratory findings showed cholesterol level 300 and LDL cholesterol was 250 milligram percent. Definitely there is a chances of atherosclerosis here. Okay, एथरोस्क्लेरोसिस है, लेकिन डायग्नोसिस में आपको एथरोस्क्लेरोसिस नहीं लिखना है, क्योंकि ये पेशेंट जो है इमरजेंसी में हॉस्पिटल आया है. इट इज बिकॉज ऑफ एक्यूट मायोकार्डियल इन्फॉक्शन. रिमेंबर दिस थिंग. एथरोस्क्लेरोसिस इज द रीजन फॉर द एक्यूट मायोकार्डियल इन्फॉक्शन. So your diagnosis is acute MI. Remember this, acute MI is the diagnosis. ठीक है, तो यहाँ पे इसके साथ साथ आपको पूछा जाएगा कि व्हाट आर द डिफरेंट कार्डियक मार्कर्स विच आर डन फॉर द असेसमेंट ऑफ एक्यूट मायोकार्डियल इन्फेक्शन. तो उसमें आपको बाकी का लिखना है, फिर वो ग्राफिकल रिप्रेजेंटेशन लिखना है या टेबल चार्ट आपको बनाना है, वो फिर सब क्वेश्चंस. ठीक है. Now see this case, a clinical case. An 18-year-old boy having flu-like symptoms. Flu-like symptoms means cough, cold, fever. Okay. Symptoms came to OPD with nausea, vomiting, and yellow discoloration of skin and sclera. Yellow discoloration मतलब jaundice. अभी jaundice hemolytic भी रह सकता है, hepatic भी रह सकता है, और obstructive भी रह सकता है. ठीक है. हेमोलिटिक मतलब जैसे G6PD डिफिशियंसी है तो हेमोलिटिक हो गया, थैलेसीमिया है तो हेमोलिटिक जॉन्डिस, सिकल सेल है तो हेमोलिटिक जॉन्डिस हो ना, है ना. और दूसरा हिपेटिक और ऑब्स्ट्रक्टिव. अभी ये जॉन्डिस से इतना तो कंफर्म हो गया, लेकिन जॉन्डिस इज नॉट ए डायग्नोसिस. इट इज नॉट ए डायग्नोसिस, इट इज ए क्लिनिकल कंडीशन. जॉन्डिस, जॉन्डिस मीन्स येलोइश डिस्कलरेशन ऑफ स्किन एंड स्क्लेरा. तो जॉन्डिस लिखोगे तो आपको मार्क मिलेंगे नहीं मिलेंगे पता नहीं, लेकिन आपको उसको डिफरेंशिएट करना है वेदर इट इज हिमोलिटिक, हिपेटिक और ऑब्स्ट्रक्टिव जॉन्डिस. ऑन लेबोरेटरी इन्वेस्टिगेशन एसजीपीटी लेवल 698, एसजीओटी 729 and alkaline phosphatase level 216 international unit per liter. Serum bilirubin direct it is 8.6, indirect it is 7.1. इसके लिए नॉर्मल की वैल्यूज आपको पता चाहिए. आपको प्रैक्टिकल एस्टिमेशन में ये सारे प्रैक्टिकल्स है. ओके. Now see here there is increase in the direct bilirubin. Normal range is 0.2 to 0.4 milligram per deciliter. Here indirect normal range is 0.1 or 0.2 to 0.7 milligram per deciliter. यहाँ पे दोनों तरह के बिलिरुबिन बढ़े हुए हैं, मतलब वैंडेनबर्ग रिएक्शन इज बाइफेजिक. ठीक है, दोनों डायरेक्ट भी बढ़ा हुआ है, इनडायरेक्ट भी बढ़ा हुआ है. कभी कभी टोटल दिया रहता और एक ही दिया रहता है इनमें से, तो माइनस करके निकालना है आपको, मतलब डायरेक्ट प्लस इनडायरेक्ट इज इक्वल टू टोटल. Now see here, SGPT levels are raised, SGOT levels are raised, and there is slight raised. Near about 70 to 120 or 150 international unit per liter is the alkaline phosphatase normal range. So here there is a raise SGPT, SGOT. So slight increase in the alkaline phosphatase. There is increase in the direct bilirubin. There is increase in the indirect bilirubin. Along with C, the flu-like symptoms. Flu-like symptoms. 18-year-old boy मतलब चांसेस है कि वो हॉस्टल में रह रहा है, उसका कोई तो भी मेडिकल कॉलेज में एडमिशन हुआ है, हॉस्टल में रह रहा है, हो सकता है उसको हेपेटाइटिस ए का इन्फेक्शन हो गया. ठीक है, और ये उसके पैरामीटर्स है. तो दैट दिस में बी ए केस ऑफ वायरल हेपेटाइटिस और हेपेटोसेलुलर जॉन्डिस. ओके. नाउ सी दिस केस 65. सी देखो यहाँ पे ओल्ड एज बताया है, ऐसा टिपिकल पिक्चर नहीं रहेगा, लेकिन सभी चीजें आपको ऑब्जर्व करनी. 65-year-old मैन came to hospital with complaint of abdominal pain. Now see, whenever there is obstruction, there is pain. Abdominal pain, pruritus means itching all over the body, and yellow colored urine. Yellow colored urine मतलब jaundice है. On laboratory investigation, the SGPT level 68, SGOT 72, alkaline phosphatase 986 international unit. So there is increase in the alkaline phosphatase activity, 986 international unit per liter. Now serum bilirubin direct is 16 milligram per deciliter. See the direct 16 milligram. So 0.2 to 0.4 is the normal range. Here indirect is also raised. So slight raise in the indirect bilirubin, but there is marked increase in the direct bilirubin, and there is marked increase in the alkaline phosphatase activity. And the symptoms, see abdominal pain, pruritus, yellow colored urine. Okay. On investigation, PT raised, OT raised, alkaline phosphatase raised, mark raised in the alkaline phosphatase activity. This increase, this this favors the diagnosis of obstructive jaundice. The cause may be different. The most common cause or the important cause is the CBD stone, मतलब कॉमन बाइल डक्ट स्टोन की वजह से ऑब्स्ट्रक्शन हो जाता बाइल के फ्लो में. Okay, why there is alkaline phosphatase activity raised? Because it is an ectoenzyme present on surface of biliary epithelium. Whenever there is regurgitation or reflux of bile due to the obstruction, it causes release of ALP from the biliary epithelium and it leaks out in the plasma. There is marked increase in the alkaline phosphatase level in obstructive jaundice, 10 to 12 times of the normal. More than 25 times of the normal, it is seen in the bone diseases because also present in the bone. What are the different isoenzymes of alkaline phosphatase? 6 isoenzymes are there. The biliary, that is alpha 1, liver alpha 2 hit labile, then placenta alpha 2 hit stable, pre beta which is present in the bone which constitute about the 50%, gamma that is intestine, and leukocyte alkaline phosphatase. These are the 6 isoenzymes of alkaline phosphatase. So आपको अगर इसके ऊपर से सब क्वेश्चंस आ सकते हैं. Now see, a 55-year-old male present to the casualty department with complaint of nausea, vomiting, pain in epigastric and right upper quadrant of the abdomen. The pain was severe, disturbing and relieved by the crouching. ऐसे सामने ऐसे बेंड किया तो रिलीव हो जाता, उसको बोलते हैं मोहम्मदियन प्रेयर साइन. तो नमाज पढ़ने की पोजीशन में गया तो थोड़ा सा कम हो जाता उसका पेन. दैट इज पेन, टिपिकल पेन ऑफ पैनक्रेटाइटिस. लेकिन ऐसा प्रॉपर डिस्कशन आपको हर बार मिलेगा ये जरूरी नहीं है. द पेन वॉज severe, disturbing, and relieved by crouching. Laboratory investigation shows serum amylase level 729 international unit per liter, and serum lipase was also raised. So this is a diagnosis of, their diagnosis is acute pancreatitis. ठीक है. ये 4 क्लिनिकल केसेस, गाउट, उसमें यूज अलोप्यूरिनॉल का, स्टैटिन्स का यूज एज ए थेराप्यूटिक, कोलेस्ट्रॉल लोअरिंग एजेंट, कॉम्पिटिटिव इनिबिटर, एंड तो ये जो 6 इंपॉर्टेंट टॉपिक है ये क्लिनिकली रिलीवेंट टॉपिक है, क्लिनिकली इंपॉर्टेंट टॉपिक है. तो ये आपको अच्छे से करके रखना है. नहीं तो होता क्या है, आप लोग पूरा एंजाइम पढ़ लेते और एग्जामिनर ने या जो भी पेपर सेटर है उसने क्लिनिकल केस डाल दिया तो आपका वो पोर्शन छूट जाता. तो ये इंपॉर्टेंट आपको करने हैं. ठीक है. तो दीज आर द इंपॉर्टेंट टॉपिक्स और क्लिनिकल केसेस फ्रॉम द एंजाइम. Now we'll start with the regulation. Regulation of enzyme activity. Regulation of enzyme activity. This is important LAQ, but the preference wise, this is should be last. But important SAQs are there. 2 important SAQs from this topic. That includes the allosteric regulation. Allosteric regulation. This is important. Short note. Allosteric regulation and regulation by covalent modification in the enzyme activity. These are the 2 important topics. तो मेरा कहना ये है आपको, ये पूरे एंजाइम में ये टॉपिक थोड़ा सा डिफिकल्ट है. पूरा मतलब ज़्यादा डिफिकल्ट नहीं है, कॉम्प्लेक्स नहीं है, थोड़ा सा डिफिकल्ट है. लेकिन इसमें के 2 शॉर्ट नोट आपको करने ही करने हैं. ये मस्ट रीड टॉपिक है, ये आपको स्किप नहीं करना है. ये 2 टॉपिक. ठीक है. तो ये 2 टॉपिक भी आपने कवर कर दिए तो इट कवर 75 to 80% ऑफ रेगुलेशन ऑफ एंजाइम एक्टिविटी. 75 to 80% of regulation of enzyme activity. Allosteric regulation and covalent modification in the enzyme activity. These are the 2 ways by which regulation of enzyme activity is done. There are other ways also which regulate the enzyme activity, that includes compartmentalization. compartmentation or mentalization, compartmentation. Then activation of latent enzyme, that is known as limited proteolysis, proteolysis or activation of latent enzyme. Then via the cascade mechanism, there is amplification of signal via the cascade mechanism. And protein protein interaction, protein protein through a small molecule, protein protein interaction, the enzyme activity is regulated. These are the different ways by which intrinsic catalytic efficiency of enzyme is regulated. Means quality of the enzyme is regulated. Okay, allosteric regulation, covalent modification in the enzyme activity means addition of small molecule that modify the enzyme activity. Then compartmentalization, different compartments, subcellular compartment, cytosol, mitochondria, endoplasmic reticulum, like that. Okay, limited proteolysis means cutting the peptide from the protein. Cascade mechanism, there is amplification of signal via the cascade mechanism and via the calcium calmodulin. Via the calmodulin on the protein interaction is there. So these are the ways through which intrinsic catalytic efficiency means control the quality of the enzyme is done. And the another mechanism is by which the synthesis or degradation of enzyme is done, that includes the induction of enzyme, which is at the genetic level, means increasing the enzyme synthesis by acting at the genetic level. Then repression means decreasing the enzyme synthesis, that is known as repression. And degradation of the enzyme, these are the ways by which the quantity of enzyme is regulated, by synthesizing the enzyme or decreasing the enzyme synthesis at the genetic level. Okay, so these are the different ways by which regulation of enzyme activity is done. मैंने पहले ही बोला आपको. So this is the major part, allosteric regulation and covalent modification of enzyme activity. So this can be asked as short note SAQ. Allosteric regulation very very important, and covalent modification in the enzyme activity very very important to remember. ठीक है, ये दो बहुत इंपॉर्टेंट है. अलो मीन्स अदर, steric means site. Allo means other, steric means site. The molecule attached to the site other than active site of an enzyme molecule. So this is known as allosteric. Okay, Shubham, noted. Okay, so see, so these are the different ways by which regulation of enzyme activity is done. So ये जो है ये आपको मेजर डिस्क्राइब करना है, एलोस्टेरिक रेगुलेशन, कोवेलेंट मॉडिफिकेशन ऑफ एंजाइम एक्टिविटी. और इसमें से ना एमसीक्यूज भी पूछे जाते हैं. इसमें बहुत सारे एमसीक्यूज है, बहुत सारे पाथवेज है जो एलोस्टेरिकली रेगुलेट होते हैं. तो उसके एमसीक्यूज और कोवेलेंट मॉडिफिकेशन के दो तीन पॉइंट जो है वो एमसीक्यू में भी इंपॉर्टेंट है. So first we'll discuss the allosteric regulation. Allosteric regulation. See here, allo means other, steric means steric means site. So suppose this is enzyme, and you know that this is active site of an enzyme molecule. This is active site means substrate binding site. Other than this active site, there is site is known as this site. It is known as allosteric site. As allosteric site. This is active site. So remember that the enzymes, these are the oligomeric proteins. These are oligomeric proteins. They are made up of different peptides. Enzymes are oligomeric protein. They are made up of different peptides. Suppose this is tetramer. This is tetramer. And allosteric site. Having the allosteric site means site other than active site of an enzyme molecule. Now see, suppose this is allosteric site of this enzyme. This is allosteric site of the enzyme. And this is substrate binding site. This site is substrate binding site. Okay, this is allosteric site, this is substrate binding site. So this is active site. Active site where substrate binds, this is other site. This is known as allosteric site. Now, this allosteric site, the enzyme having the allosteric site, they are known as allosteric enzymes. They are known as allosteric enzymes. Okay, they are generally oligomers. They are oligomeric proteins composed of different peptides, and they show one phenomenon, important phenomenon, that is known as cooperativity. Cooperativity. This is shown by the allosteric enzymes. Cooperativity. This is very, very important. The binding of one molecule to one unit, binding of one molecule to the one subunit causes the changes in other unit. Suppose there is allosteric inhibitor or allosteric regulator, which can be inhibitor, which can be activator. The binding of allosteric molecule or allosteric regulator to the one subunit of that enzyme causes changes in this active site. If it is allosteric activator, suppose this is activator, the activator will favor the formation of enzyme substrate complex. Activator will favor the formation of enzyme substrate complex, okay, by causing the conformational change in the active site of an enzyme molecule. ये अलग ऑलिगोमर है, ये अलग पेप्टाइड है, ये अलग पेप्टाइड है, अलग अलग सब यूनिट है. ये दूसरे जगह पे बाइंड होके भी ये यूनिट को इन्फ्लुएंस कर रहा, ये यूनिट में कन्फर्मेशनल चेंजेस कर रहा. तो दिस इज अलोस्टेरिक रेगुलेशन. दिस इज कोऑपरेटिविटी. इज शोन बाय ऑक्सीजन. is shown by oxygen binding to the hemoglobin, cooperativity. And because of this there is sigmoidal curve. हमने जो एंजाइम और सबस्ट्रेट का देखा है उसमें हमने हाइपरबोलिक ऐसी वाली कर्व देखी. नॉर्मली नॉर्मली कर्व कैसी देखी, ऐसी वाली कर्व देखी हमने. इसमें ऐसी कर्व नहीं रहती. बिकॉज ऑफ कोऑपरेटिव बाइंडिंग देर इज सिग्मोइडल एस शेप कर्व. देर इज एस शेप कर्व when substrate concentration is plotted versus the velocity of the reaction. So allosteric enzyme, they will show the sigmoidal curve. They will show the sigmoidal curve. Okay. तो अलोस्टेरिक रेगुलेशन क्या लिखना है अभी. अलोस्टेरिक रेगुलेशन में हमको क्या लिखना है, तो स्टार्ट करने का. अलो मीन्स अदर, स्टेरिक मीन्स साइड. द एंजाइम हैविंग द अदर साइड other than the substrate binding site, it is known as allosteric enzymes. They are known as allosteric enzymes. Allosteric enzymes, they are oligomers. They are made up of different subunits of peptides. They are made up of different subunits. And they show cooperativity. Cooperativity means binding of the regulatory molecule to the one unit causes changes or confirmatory changes. Confirmatory changes matlab rearrangement of amino acid. Rearrangement of amino acid. All of you know that the active site of an enzyme, it is formed by the arrangement of amino acid, three-dimensional arrangement of amino acid. What is active site? It is cleft, crevices or pocket on the big enzyme molecule which is formed by the amino acids which are away from each other in the linear sequence, but in the three-dimensional structure they form pocket or cleft or crevices. Okay, so this is allosteric site. This is the regulator. If it is activator, it favors the formation of substrate to the active site of an enzyme molecule. Got it? So it shows cooperativity, means also this cooperativity means binding of one molecule. Binding of one molecule influences the binding of other molecules. For example, O2 binds to the hemoglobin. When one molecule of O2 binds with the hemoglobin, each subsequent O2 binds with the more affinity, 100 times more affinity than the previous one. That is known as cooperative binding. That is known as cooperative binding. So allosteric inhibitor means allosteric enzymes. There are two conformation. कौन से दो conformation है? See, this shows two conformations. One is the known as tense or taut state. Tense or taut state. One is known as tense or taut state, and it is favored by this tense or taut state. It is favored by, suppose uh, this is active site. This is active site. This is allosteric site. This is allosteric site. Suppose, and this tense state or taut state, it is favored by the allosteric inhibitor. It is if the allosteric inhibitor binds to the allosteric site, it favors the tense or taut state. Okay, and the substrate will not bind. This case, substrate will not bind to the active site of an enzyme molecule. This is favored by the allosteric allosteric. If the allosteric regulator decreases the inhibitor, decreases the reaction velocity, it is known as allosteric inhibitor, or it is also known as negative effector. Is known as negative effector. It favors the formation of tense state. In contrast, there is relaxed state. There is one state that is known as relaxed state. This is a relaxed state of an enzyme, allosteric enzyme. Relaxed state. In relaxed state, the binding of modulator or regulator, suppose this is regulator and which is activator, allosteric activator. So name is allosteric activator or positive effector or positive effector. It favors the binding of substrate to the enzyme, the active site of an enzyme molecule. So it is known as allosteric activator or relaxed state of an enzyme. So allosteric effector, which is a positive modifier or positive effector, favor the formation of enzyme substrate complex, while negative effector, it favors the tense state. It will not favor the binding of substrate to the active site of an enzyme. So tense state, relaxed state, allosteric enzyme, tense state, they are in the tense state, relaxed state. Relaxed state favor the formation of enzyme substrate complex. Tense state does not favor the formation of enzyme substrate complex. This is favored by the allosteric inhibitor. This is favored by the allosteric activator. Now the dissociation curve. See this dissociation curve. Is substrate concentration, is velocity of the reaction. Substrate concentration, velocity of the reaction. Now see, this is S shape. This curve is S shape, sigmoidal in shape. This curve is sigmoidal in shape because of cooperative binding. Normally, this is allosteric enzyme. In presence of negative effector matlab inhibitor. In presence of inhibitor, this curve will shift to the left. This curve will shift to the left in presence of this is negative effector or inhibitor. inhibitor, allosteric inhibitor in presence of negative effector or negative modifier, or in presence of inhibitor which decreases the velocity. So it will shift to the left. It will shift to the left. While in presence of the positive, just wait, there is correction. In presence of positive effector, in presence of positive effector which favors the reaction. Positive effector means modifier, or positive regulator means allosteric activator. Allosteric activator. In presence of allosteric activator, it favors the formation of enzyme substrate complex. So substrate concentration required is very low in presence of allosteric activator. So it will shift to the left. While in presence of negative effector, it is shifted to the right. Is shifted to the right in presence of inhibitor. Allosteric का काम कहाँ पे मैं बताता हूँ. Allosteric inhibitor. This is without activator or inhibitor. Okay. Now this is substrate concentration. This is Vmax. So this is Vmax. This is Vmax, maximum velocity. This is half of the Vmax. Okay. Now these are the corresponding point. This is Km1. This is Km2. This is Km3. Km1, 2, 3. Okay. Now see, in presence of allosteric activator, जो reaction को बढ़ाता है, activator, the substrate concentration required is low. Lower substrate concentration is required to achieve the maximum velocity. While in presence of the negative effector, higher substrate concentration is required. So in presence of allosteric activator, Km value, it is decreased. Km decreases. While in presence of allosteric inhibitor, Km increases. Now see, so this is important, particularly important. So you can take one example here. The aspartate transcarbamylase. Aspartate transcarbamylase. Aspartate transcarbamylase. This is enzyme. This is a rate limiting enzyme in pyrimidine nucleotide synthesis, in the synthesis of cytidine triphosphate. So it is important rate limiting enzyme, carbamyl oil phosphate. This is aspartate. So aspartate transcarbamylase is converted into carbamyl aspartate, and it is converted into, through various steps, it is converted into that is cytidine triphosphate. It is converted into cytidine triphosphate. Now cytidine triphosphate is the inhibitor. See, this cytidine triphosphate, it is inhibitor of aspartate transcarbamylase, is inhibitor, and ATP is the activator. ATP is the activator. ATP activates this enzyme. ATP stimulates the cytidine triphosphate synthesis. So ATP is the positive modifier here. So in presence of ATP, the reaction will shift to the left. The curve will shift to the left, and in presence of CTP, which is a negative effector, reaction will shift to the right. The one important example is oxygen dissociation curve, where 2,3-BPG shift the curve to the right. It is a negative effector which is important for unloading of oxygen to the tissue. टिश्यू को ऑक्सीजन सप्लाई होने के लिए, हीमोग्लोबिन से डिटैच होने के लिए 2,3-BPG लगता है, जो कि रैपोर्ट लूबरिंग साइकिल में बनता है 2,3-बिसफॉस्फोग्लिसरेट. It is a negative effector which shift the curve to the right, So remember here, this is example cytidine triphosphate. It is allosteric inhibitor of aspartate transcarbamylase, while ATP is the activator of aspartate transcarbamylase. ATP stimulates the cytidine triphosphate synthesis. Aspartate transcarbamylase is the important enzyme in the cytidine triphosphate synthesis. So now examples. अभी इसको एक बार मैं रिवाइज करूंगा फिर से. Now examples. See, these are the activators, allosteric activators, then inhibitors. At least remember 2 to 3 examples, inhibitors, then enzymes, allosteric enzymes. Remember the one important, that is phosphofructokinase, phosphofructokinase. कौन से पाथवे में है फॉस्फोफ्रुक्टोकाइनेज? जस्ट रिमेंबर, ट्राई टू रिमेंबर. It is important in the glycolysis. Phosphofructokinase, it is important enzyme in the glycolysis. It is a rate limiting enzyme in the glycolysis, where fructose 6 phosphate is converted into fructose 1,6 bisphosphate. Okay, phosphofructokinase. So activator of phosphofructokinase is AMP. AMP, it is activator, while the citrate is the inhibitor. Citrate inhibits the phosphofructokinase. This is important. जो एमसीक्यू में पूछा जा सकता वही एग्जांपल हमने डिस्कस किए. सेकंड, सी सेकंड इंपॉर्टेंट, द एसिटिल कोएंजाइम ए carboxylase. Carboxylase. This is enzyme. This is rate limiting enzyme of fatty acid synthesis. The important pathway, fatty acid synthesis, acetyl coenzyme carboxylase. So here citrate in this pathway, the citrate is the activator. Citrate is the activator of acetyl fatty acid synthesis. This is acetyl coenzyme carboxylase. Citrate is the activator, while the end product, palmitoyl coenzyme A. Palmitoyl coenzyme A, it is inhibitor, allosteric inhibitor of acetyl coenzyme carboxylase. The third important is aspartate transcarbamylase, जो अभी हमने डिस्कस किया. Third one is the aspartate transcarbamylase. So here activator is ATP and inhibitor is CTP, cytidine triphosphate. ओके इसके जैसे और बहुत सारे एग्जांपल है, जैसे CPS1 ऑफ यूरिया साइकिल, इट इज एक्टिवेटेड बाय एन एसिटिल ग्लूटामेट. CPS2 of pyrimidine nucleotide synthesis, it is activated by the PRPP, phosphoribosyl pyrophosphate. So these are the some important examples. Remember at least 2 to 3 examples of allosteric inhibition. So this is very, very important short note. Allosteric inhibition. Once again, I will revise this. See, allo means other, steric means site. The enzyme having the site other than active site, it is known as allosteric enzymes. There are modifier which is of two type, which can increases the reaction velocity or decreases the reaction velocity. The modifier which increases the reaction velocity, they are known as allosteric activator, and the modifier which decreases the reaction velocity or regulator which decreases the reaction velocity, they are known as allosteric inhibitor. They are known as allosteric inhibitor. The enzyme having the allosteric site means site other than active site of an enzyme for binding of regulatory molecule, it is known as, they are known as allosteric enzymes. Okay, now they are generally oligomers, means different polypeptide. They are composed of different units of polypeptide. So they show cooperativity. Cooperativity means the binding of regulatory molecule to the one unit causes changes in the other unit. So this shows cooperativity, means the binding of one molecule increases the binding of subsequent molecules. This can be explained with the help of oxygen dissociation curve, in which binding of one O2 to hemoglobin increases the binding of another O2 to hemoglobin by the many times. Means it increases the binding of other oxygen to the hemoglobin. So this is known as cooperativity. Binding of one molecule to the regulatory molecule to the one unit causes changes, confirmatory changes in the active site of an enzyme molecule. So there are two states. It shows the sigmoidal shape curve. It shows the sigmoidal shape curve. In case of normal, this is hyperbolic curve. It shows sigmoidal shape curve when we plot a graph of substrate concentration versus velocity of the reaction. Okay, so there are two states of the enzyme, the tense state or taut state and the relaxed state. The negative effector will not favor the binding of substrate to the active site of an enzyme. It is known as tense state. And relaxed state means the modifier, the positive modifier or regulator, which favors the formation of enzyme substrate complex and ultimately product. It is known as relaxed state of the enzyme. Okay. Now, this is the curve. This is allosteric enzyme which shows sigmoidal dissociation, the sigmoidal curve when the substrate concentration is plotted versus the velocity of the reaction. But when positive effector or positive modifier or activator is there, in presence of positive modifier, the required substrate is low. The concentration of substrate is low, means less substrate is required. Okay. In presence of allosteric activator, less substrate is required. So Km decreases in case of allosteric activator. While when there is allosteric inhibitor, the substrate concentration, more substrate concentration is required. So in case of allosteric, with in presence of allosteric inhibitor, the substrate concentration required is more. So here Km value, Km is nothing but the substrate concentration to produce half of the maximum velocity. So here it increases, Km increases in presence of allosteric inhibitor. Okay. So example is carbamyl phosphate is converted into cytidine triphosphate. This is pyrimidine metabolism. This is pyrimidine metabolism. Here the rate limiting enzyme is aspartate transcarbamylase. It is inhibited by the cytidine triphosphate, which is allosteric inhibitor of aspartate transcarbamylase, and ATP is the allosteric activator of aspartate transcarbamylase. These are the different examples. Phosphofructokinase of glycolysis. It is a regulatory step which converts the fructose 6-phosphate into fructose 1,6-bisphosphate. AMP is the activator, citrate is the inhibitor. Remember, this citrate is very, very important here as MCQ. Very, very important MCQ. So citrate is the inhibitor of phosphofructokinase, while citrate is the activator of fatty acid synthesis, that is acetyl coenzyme carboxylase. Okay, and this is the pyrimidine metabolism in which cytidine triphosphate is produced. So cytidine triphosphate inhibits the aspartate transcarbamylase, while ATP, adenosine triphosphate, stimulate the aspartate transcarbamylase. So it is allosteric regulation. एक पार्ट हो गया, एक SAQ हो गया. दूसरा इंपॉर्टेंट SAQ है कोवेलेंट मॉडिफिकेशन इन द एंजाइम एक्टिविटी. Covalent modification in enzyme activity, it is mainly done by the phosphorylation and dephosphorylation. और यहाँ पे एक MCQ बनता ही है, ये हाईली रेटेड टॉपिक है फॉर MCQ, for your professional examination, also for the NEET examination. This is highly rated topic for the MCQ. Now what is phosphorylation? Phosphorylation means addition of phosphate, and dephosphorylation means removal of phosphate. Now there are some enzymes which are active in the phosphorylated state, and some enzymes are there which are active in the dephosphorylated state. कुछ एंजाइम जो है वो फॉस्फेट ऐड करने के बाद एक्टिव हो जाते, कुछ एंजाइम्स ऐसे हैं जो फॉस्फेट निकालने के बाद एक्टिव हो जाते. ठीक है, ऐसे दो अलग अलग तरह के एंजाइम्स है. तो कोवेलेंट मॉडिफिकेशन इन द एंजाइम एक्टिविटी मतलब कुछ तो भी मॉलिक्यूल एक ऐड कर दिया, उसके वजह से एंजाइम का जो स्टेटस है एक्टिव एंड क्या बोलते हैं एक्टिव, और क्या बोलते हैं उसके अपोजिट, इसको एक्टिव है और नॉन एक्टिव है ना. सम आर एक्टिव इन द फॉस्फोराइलेटेड स्टेट, सम आर एक्टिव इन द डीफॉस्फोराइलेटेड स्टेट. ओके, कोवेलेंट मॉडिफिकेशन मींस एडिशन ऑफ न्यू मॉलिक्यूल टू द एंजाइम. नाउ सी, दिस इज एंजाइम, this is enzyme, this is the amino acid. The most common amino acid at the active site of an enzyme is the serine. serine, threonine, tyrosine. These are the important amino acid at the active site of an enzyme. And this is hydroxyl group. This is hydroxyl group. In the phosphorylation, ATP donates the phosphate. Phosphorylation, ATP donates the phosphate. So enzyme serine at the active site, and it is phosphorylated. Phosphate is added to the serine. The most important amino acid at the active site is the serine or threonine or the tyrosine. So here serine is phosphorylated. So enzyme is phosphorylated with the help of protein kinase. Protein kinases. Protein kinase causes the phosphorylation. Addition of phosphate to the enzyme. This is known as phosphorylation. This example of phosphorylation. Phosphorylation. Okay, addition of phosphate to the enzyme. Now, what is dephosphorylation? In the dephosphorylation, see, the phosphate is removed. Phosphate is removed from the enzyme. Phosphate is removed from the enzyme via the phosphatase. Via the phosphatase. So, this reaction is known as dephosphorylation. ठीक है, एकदम सिंपल है. एडिशन ऑफ फॉस्फेट मीन्स फॉस्फोराइलेशन एंड रिमूवल ऑफ फॉस्फेट मीन्स डीफॉस्फोराइलेशन. लेकिन आपको उसको रिप्रेजेंट करना पड़ेगा ना पेपर में. तो रिप्रेजेंट कैसे करने का? तो दिस इज एंजाइम, दिस इज सीरिन at the active site of an enzyme, and to this serine there is addition of phosphate with, and it is phosphate, it is donated by the ATP, and the enzyme required here is protein kinase. So protein kinases causes the phosphorylation, while protein phosphatase causes the dephosphorylation. So this is phosphorylation, this is dephosphorylation. Phosphorylation, dephosphorylation. Addition of phosphate, removal of phosphate. Addition is done by the protein kinase, removal is done by the phosphatase. इतना समझ में आया? ठीक है. तो कुछ एंजाइम्स जो है वो फॉस्फोराइलेशन स्टेट में, फॉस्फोराइलेटेड स्टेट में एक्टिव रहते, कुछ जो है वो डिफॉस्फोराइलेटेड स्टेट में एक्टिव रहते. अभी इसके चार चार एकदम इंपॉर्टेंट एग्जांपल्स है जो कि एमसीक्यू में पूछे जाते हैं और वो आपको याद रखने हैं. ठीक है, तो कोई न्यूमोनिक तो है नहीं. तो देर आर सम examples of enzymes which are active in the phosphorylated state. Phosphorylated state. They are active in the phosphorylated state. So remember these four important enzymes that are active in the phosphorylated state. It includes glycogen phosphorylase. Glycogen, उसके नाम में ही है देखो, phosphorylase. Glycogen phosphorylase. Then phosphorylase B kinase. Glycogen phosphorylase B kinase. Phosphorylase B kinase. This is active the phosphorylated state. Then ATP citrate lyase. ATP citrate lyase. This is active in the phosphorylated state. And HMG coenzyme A reductase kinase. Remember, reductase kinase, not reductase. Reductase kinase. HMG coenzyme A reductase kinase. These are the four important enzymes which are active in the phosphorylated state. This is top rated topic for MCQ. Remember this. These are the enzymes which are active in the phosphorylated state. Gluconeogenesis, enzymes of gluconeogenesis. They are active in the phosphorylated state. Phosphorylated state, it is principally favored by the glucagon. It is favored by the glucagon. Now some enzymes which are active in the dephosphorylated state. Removal of the phosphate. मुझे तो लगता है आप सबके मतलब आपके रेगुलर क्लासेस हो रहे हैं सभी जगह के. दिवाली वैकेशन से आपने ज्वाइन कर लिया तो आप सबको तो एंजाइम टॉपिक, मोस्ट ऑफ द पीपल का एंजाइम टॉपिक पढ़ा के हो गया होगा, क्योंकि ये पहला टॉपिक है जो जनरली पढ़ाते हैं. ठीक है, आफ्टर द सेल एंजाइम अकॉर्डिंग टू द एमसीआई कॉम्पिटेंसी. तो ये आपका सॉर्ट ऑफ रिवीजन ही है, ऐसा मुझे लगता है। डीफॉस्फोराइलेटेड स्टेट, so there are some enzymes which are active in the dephosphorylated state that includes glycogen synthase, and it is favored by the insulin. Insulin favors the dephosphorylation of enzyme. So glycogen synthase, then HMG coenzyme A reductase. Then third one is the pyruvate dehydrogenase complex. Pyruvate dehydrogenase complex, acetyl coenzyme A carboxylase. ये अगर आपने याद कर लिया कार्बोक्सिलेज, तो आपको बहुत सारे पाथवे का रेगुलेशन याद नहीं रखना पड़ता। देखो, ग्लाइकोजन सिंथेस, ग्लाइकोजेनेसिस, एचएमजी कोएंजाइम रिडक्टेज, कोलेस्ट्रॉल बायोसिंथेसिस, पाइरुवेट डिहाइड्रोजनेस कॉम्प्लेक्स लिंक्ड रिएक्शन, एसिटिल कोएंजाइम कार्बोक्सिलेज फैटी एसिड सिंथेसिस के ये सब रेट लिमिटिंग एंजाइम्स है। और जब उनका रेगुलेशन आएगा तब आप क्या लिखोगे? इट इज रेगुलेटेड बाय द कोवेलेंट मॉडिफिकेशन इन द एंजाइम एक्टिविटी बाय फॉस्फोराइलेशन एंड डिफॉस्फोराइलेशन। तो दीज एंजाइम्स आर एक्टिव इन द डिफॉस्फोराइलेटेड स्टेट। इतना भी लिखा तो भी 2 मार्क का है। रेगुलेशन, रेगुलेशन का पाथवे कितने, 10 मार्क का पाथवे अगर आया तो उसमें से 2-3 मार्क रेगुलेशन पे रहते हैं। ठीक है, तो ग्लाइकोजन मेटाबॉलिज्म, कोलेस्ट्रॉल बायोसिंथेसिस, लिंक्ड रिएक्शन एंड द फैटी एसिड सिंथेसिस, ऑल्सो द glycolysis. Glycolysis. The enzymes of glycolysis, pyruvate kinase, it is active in the dephosphorylated state. So dephosphorylated state, it is favored by the insulin. Phosphorylated state, it is favored by the glucagon. Now see one example. I will show you one example. तो जब तक आपका ग्लाइकोजन मेटाबॉलिज्म नहीं होगा तब तक आपको ये एग्जांपल समझेगा नहीं, लेकिन फिर भी हम यहाँ पे कोशिश करते हैं। ठीक है, क्योंकि ये दूसरे में भी हमको काम का है। तो नाउ सी ग्लूकागॉन इन लीवर, ग्लूकागॉन, हमने क्या बोला? ग्लूकागॉन फेवर द फॉस्फोराइलेटेड स्टेट। तो ग्लूकागॉन इन लीवर एंड इपिनेफ्रिन इन लीवर एंड मसल, ग्लूकागॉन एंड इपिनेफ्रिन, glucagon in liver and epinephrine in liver and muscle, they stimulate the cyclic AMP, they stimulate the adenylyl cyclase, they stimulate the adenyl cyclase or adenylyl cyclase, and this adenyl cyclase causes the conversion of ATP into cyclic AMP. It causes conversion of ATP into cyclic AMP. Now this cyclic AMP, it causes the activation of protein kinase. It activates the protein kinase. So inactive protein kinase is converted into active protein kinase with the help of cyclic AMP. Now this protein kinase, what is function of protein kinase? It causes the phosphorylation. It causes the phosphorylation of phosphorylase kinase. Phosphorylase kinase, and this phosphorylase kinase causes the phosphorylation of glycogen phosphorylase. Glycogen phosphorylase. This glycogen phosphorylase is the rate limiting enzyme of, it is a rate limiting enzyme of glycogenolysis. So glycogen is degraded into glucose. Glycogen is degraded into glucose. So this is how the glucagon and epinephrine, by the cascade mechanism, why the cascade, this is a cascade mechanism. There is small stimulus, the hormonal stimulus, which causes amplification of signal. So there is stimulation of adenyl cyclase, which causes conversion of ATP into cyclic AMP. Cyclic AMP stimulates the inactive protein kinase into active protein kinase, which converts the inactive phosphorylase kinase into the active phosphorylase kinase, and this causes the stimulation of phosphorylase kinase, means glycogen phosphorylase, and this is rate limiting enzyme in the glycogenolysis, means degradation of glycogen into the glucose. Degradation of glycogen into the glucose. So this is how the phosphorylation and dephosphorylation works. So this is, see, protein kinase causes phosphorylation of phosphorylase kinase. Phosphorylase kinase causes phosphorylation of glycogen phosphorylase, and this is active. Now this will converts glycogen into glucose. Will converts glycogen into glucose via the glucagon and epinephrine. So this is covalent modification. तो ये जो दो examples है, allosteric regulation एंड कोवेलेंट मॉडिफिकेशन इन द एंजाइम एक्टिविटी, ये बिल्कुल आपको अच्छे से करनी है। ओके, Now, activation of latent enzyme. Third mechanism, activation of latent enzyme, in which the digestive enzymes, means inactive inactive zymogens, they are converted into active one by the proteolysis, limited proteolysis. For example, pepsinogen is converted into pepsin via the HCl. Pepsin by the HCl, or pepsin itself also catalyzes the conversion of pepsinogen into pepsin. Now, trypsinogen, these are the digestive enzyme. Trypsinogen is converted into trypsin. Trypsin itself catalyzes the conversion of trypsinogen into trypsin, or enterokinase or enteropeptidase, that causes the conversion of trypsinogen into trypsin. Then chymotrypsinogen is converted into chymotrypsin. Chymotrypsin. This is via the trypsin. Trypsin. Then proelastase. Proelastase is converted into elastase. And procarboxypeptidase is converted into carboxypeptidase. So they are important in the digestion and absorption of protein. So these are the peptidases which are important in the digestion and absorption of the protein. By cutting the peptide, smaller peptide, these are activated. So pepsinogen by the HCl or pepsin itself is converted into pepsin. Trypsinogen by the enteropeptidase, it is converted into trypsin, or trypsin also catalyzes its own conversion. Chymotrypsinogen is converted into chymotrypsin. Proelastase is converted into elastase. Procarboxypeptidase is converted into carboxypeptidase. So this is known as limited proteolysis, in which inactive zymogens are converted into active one. Then there are certain modes by which enzyme activity is regulated, that is known as compartmentalization. In the compartment, there are different compartment in the cell. Cytoplasm, mitochondria, endoplasmic reticulum is there. Different subcellular organelles are there. The one example is C. Fatty acid, means beta oxidation of fatty acid. It occurs in the mitochondria, mitochondrial matrix, while fatty acid synthesis, it occurs in the cytosol. So compartmentalization of the pathway is important in the regulation of enzyme activity. Some pathways are occurring in the mitochondria, some occurs in the cytosol. Okay, so compartmentalization is important. Also, subcellular translocation is also regulated. For example, heme regulates the translocation of ALA synthase from cytosol to the mitochondria. So this is known as compartmentalization. Now see, this is glycine plus succinyl coenzyme A. Succinyl coenzyme A, ALA synthase is the enzyme. This catalyzes the formation of del-aminoleucinic acid. This is the first step in the heme synthesis. Glycine plus succinyl coenzyme A. It forms del-aminoleucinic acid, and through various steps, it will form heme. Now, heme regulates the translocation of this ALA synthase from cytosol to mitochondria. So this is mitochondrial step, and it is regulated by the heme. So this is important in the compartmentalization. Compartmentalization is important. Okay, compartmentalization. Then some smaller molecules, for example, protein-protein interaction, some calmodulin-like substance. Calmodulin activates the calcium. It by combining with the calcium, calmodulin calcium complex activates the various kinases. Also, the amplification of signal in the form of cascade mechanism, as we seen this in the glycogen metabolism, via the various cascade mechanism, there is amplification of signal occur. So this is a, now see, so we discussed the allosteric regulation. We discussed the covalent modification in the enzyme activity, that is phosphorylation and dephosphorylation. Compartmentalization, some pathways are active in the cytosol, some are active in the mitochondria. Example is fatty acid synthesis, it is active in the cytosol, it takes place in the cytosol, while the fatty acid oxidation, it occurs in the mitochondrial matrix. Limited proteolysis, by cutting the peptide, some zymogens or inactive molecules are activated. For example, pepsinogen is converted into pepsin, trypsinogen is converted into trypsin, like this. Then cascade mechanism, this is example. In this, there is amplification of signal, like clotting pathway, clotting mechanism is there, or the glycogen metabolism regulation, it is via the cascade mechanism. Through a hormonal signal there is amplification of signal occurs, that is known as cascade mechanism. And protein interaction, here small molecule calmodulin like substance, example is calmodulin form the complex with the calcium, and they activates various kinases. So calcium calmodulin dependent kinases, and they causes the regulation of enzyme activity. So these are the different ways by which enzyme activity is regulated. Another mode is induction, repression, and degradation, where synthesis and degradation of enzyme is regulated. Synthesis and regulation of enzyme is regulated. This occurs at the genetic level. This occurs at the genetic level. Genetic level. So how this occurs? Just wait. Discuss this. At least induction and repression we will discuss. See, induction means increase in the enzyme synthesis. Induction means increase in the enzyme synthesis. This occurs at the genetic level. Now see, glucagon induces the pyruvate carboxylase. So glucagon induces pyruvate carboxylase. There is no need to remember the pathway and all, but try to remember जिसका इंडूसेस मतलब इंक्रीज करता है सिंथेसिस बाय एक्टिंग एट द जेनेटिक लेवल. एक मैं बता देता जस्ट आइडिया आने के लिए. तो सी ग्लूकागॉन इट थ्रू द जी प्रोटीन कपल्ड रिसेप्टर, glucagon through the G protein coupled receptor activates the various protein kinases. It activates protein coupled receptor. It activates the uh, adenyl cyclase. It activates the uh, adenyl cyclase and causes the formation of protein or activation of protein kinases. And this protein kinases will activates the transcription factor, various transcription factor. And this transcription factor binds with the various hormone responsive elements. It it binds with the various hormone responsive element, and it causes the transcription and translation of transcription and translation of enzyme, translation of this pyruvate carboxylase. So it is produced pyruvate carboxylase. So it induces the pyruvate carboxylase. Glucagon induces pyruvate carboxylase means glucagon increases the synthesis of pyruvate carboxylase. This is important enzyme of gluconeogenesis. Gluconeogenesis means synthesis of glucose from the non carbohydrate precursors. तो ये ग्लूकोज का सिंथेसिस प्रमोट करता है कौन? ग्लूकागॉन via the pyruvate carboxylase by inducing the synthesis of pyruvate carboxylase. Similar way, the insulin, see here, insulin, it decreases, insulin decreases or represses, the name is repression, represses the pyruvate carboxylase. Insulin decreases the synthesis of pyruvate carboxylase. So insulin decreases the glucose production. Glucagon increases the glucose production. Okay, so the induction means increase synthesis, and repression means decrease the enzyme synthesis at genetic level. Okay, so induction and repression. And degradation of enzyme, degradation means via the various ubiquitination, ATP dependent and ATP independent ubiquitin dependent pathways, the degradation of enzyme activity occurs. Degradation of enzyme activity occurs by the ATP dependent and ATP independent pathways. Okay, degradation of enzyme occurs. So these are the different ways by which enzyme activity it is regulated. So these are the different ways by which enzyme activity is regulated. So we started here. Here is the end of chapter that is enzyme. ओके तो एंजाइम में हमने क्या क्या डिस्कस किया देखो एंजाइम जब हमने स्टार्ट किया तो हमने बोला था वो हमने 17 वाइट हार्सेस वाली एक स्टोरी हमने डिस्कस की 17 वाइट हॉर्सेस तो हमने उसका डिवीजन बोला था तो फिर एक उसका वो मर्चेंट का दोस्त रहता वो ब्लैक हॉर्स देता फिर वो 18 हो जाते फिर डिवीजन पॉसिबल हो जाता तो ब्लैक हॉर्स जो था वहाँ पे कैटलिस्ट था तो एंजाइम्स आर द बायो कैटलिस्ट वी आर नाउ रिवाइजिंग द एंटायर चैप्टर जस्ट वेट now we are revising the entire chapter see what is enzyme they are biocatalyst and they are CTPS in nature colloidal thermolabile protein and specific in their action except ribozymes. Ribozymes are active because of RNA part, not due to protein part. So all enzymes are proteins except ribozymes. Ribozymes are active because of RNA part. So now these enzymes they are CTPS in nature, colloidal, thermolabile, protein and specific in their action. How many classes are there? There are total 7 classes. Sequence is very important because first digit represent the class. So oxidoreductase, transferase, hydrolases, liases, isomerase, ligase, and translocase. 7 classes. OTHLILT. OTHLILT. 7th class is added in the 2018. Okay, this is classification. Different factors affecting enzyme activity or velocity of the reaction that include substrate concentration, enzyme concentration, product concentration, pH, temperature, effect of activators, effect of inhibitors. Okay, these are the different factors affecting the enzyme activity. In the mechanism of enzyme action, 4 points are important. Enzyme lowers the activation energy, favor the formation of transition state. Different theories related with enzyme substrate complex formation that includes the lock and key model, then substrate strain theory and the induced fit model that is Coastland model, induced fit model. Okay, uh, these are this is third point and the fourth actual mechanism of catalysis which include acid base catalysis, covalent catalysis and the proximity. Okay, this is mechanism of enzyme action. Then in enzyme inhibition, the competitive inhibition, non-competitive inhibition, uncompetitive inhibition, the irreversible inhibition, suicide inhibition, feedback inhibition. These are the different types of inhibition which is again important LAQ, enzyme inhibition. Here the SAQ, short answer question, therapeutic uses of competitive inhibitors. Difference between competitive and non-competitive inhibition. Okay, this is enzyme inhibition. The next important LAQ is isoenzyme and diagnostic uses of enzyme, where you can get import LAQ, the different isoenzymes examples, LDH 1, 2, 3, 4, 5, CPK 1, 2, 3 are also known as BB, MB, MM. Then alkaline phosphatase 6 isoenzymes are isoforms because they differ because of their post-translational modification. Okay, and different uses in the diagnosis of liver diseases, in the diagnosis of heart diseases, diagnosis of bone diseases, diagnosis of pancreatic diseases, and diagnosis of various cancers. These enzymes are useful. Okay. Apart from this, there are therapeutic and the laboratory uses of enzymes which can be asked as a BAQ 2-mark questions. Therapeutic uses of enzymes and the laboratory uses of enzymes. Okay. इसके बाद में हमने रेगुलेशन ऑफ एंजाइम एक्टिविटी डिस्कस किया जिसमें हमने allosteric regulation, covalent modification in the enzyme activity, then proteolysis, compartmentalization, protein-protein interaction, that is palmodulin calcium complex we discussed, and the cascade mechanism and induction, repression and enzyme degradation. These are the different ways by which enzyme activity is regulated. This is all about the enzyme chapter. Okay, so learn this chapter. This is very important chapter because in the most of the institute this chapter is taught by the professor. So this is very important. देखो मैं ऐसे क्यों बताता हूँ इम्पोर्टेंट, सुज्ञान कुमार त्रिपाठी। तो ऐसे क्यूज इंपॉर्टेंट कौन कौन से है, जस्ट वेट। इसमें क्लिनिकल केसेस आएंगे, क्लिनिकल केसेस दैट इंक्लूड्स acute myocardial infarction, then hepatic jaundice, obstructive jaundice, pancreatitis, pancreatitis. These can be asked as LAQ. Then isoenzymes, important LAQ, isoenzymes. Then competitive inhibition, competitive inhibition. Then uses, therapeutic uses of competitive inhibitors, of competitive inhibitors. These are the important questions. Okay. Then coenzymes, enzyme pattern in liver diseases, pattern in liver diseases. Then allosteric inhibition, allosteric regulation, and covalent modification in the enzyme activity. Covalent modification in enzyme, that is phosphorylation and dephosphorylation. These are the important short answer questions from this chapter. Okay. LAQ, it includes uh, classification of enzyme with suitable example, classification of enzyme, different factors affecting enzyme activity, mechanism of action, then diagnostic importance of enzymes, enzyme inhibition, and regulation of enzyme activity, these are the important LAQs. ठीक है, तो classification of enzyme with suitable example, different factors affecting enzyme activity, mechanism of enzyme action, diagnostic importance of enzyme inhibition and regulation of enzyme activity. These are the LAQs. These are the clinical cases: MI, myocardial infarction, hepatic jaundice, obstructive jaundice, pancreatitis. Also clinically important topic, that is statins and allopurinol in gout. Statins in to decrease the cholesterol level. Allosteric regulation, isoenzymes, competitive inhibition, therapeutic uses of competitive inhibition, coenzyme, enzyme pattern in liver diseases, and covalent modification in the enzyme activity. These are the important SAQ. Okay, so this is all about the. Thank you. So it is not necessary, Rishi. It is not necessary that each and every point इंक्लूड हो आपके आंसर में, और क्लास में 45 मिनट का टाइम रहता, उसमें इतना पॉसिबल भी नहीं होता कवर होना। ठीक है, तो दिस इज़ लाइक, मतलब हम अभी प्रोफेशनल कोर्सेस में, तो मैक्सिमम पोर्शन मतलब थोड़ा बहुत कवर होता है कॉलेज में, थोड़ा बहुत हमको खुद करना पड़ता है। ठीक है, तो इसीलिए हम यहाँ पे कोशिश करते हैं कि जितना पॉसिबल हो उतना हम आपको उतनी प्रैक्टिस आपको हो जाए। लेकिन ऑनलाइन प्लेटफॉर्म, मतलब हम जैसे भी अभी ऑनलाइन पे पढ़ाते हैं, तो फेस टू फेस ये होता नहीं है इंटरेक्शन, तो इनकारपोरेट और रिटेंशन थोड़ा ये होता है। इसलिए मैं बोलता हूँ कि जब भी मैं पढ़ाता हूँ आप अपने खुद के नोट्स बनाओ, जब भी मैं पढ़ाता हूँ आप अपने खुद के नोट्स बनाओ, ताकि रिपीटेशन हो। आप जब लिखते हो आपका रिपीटेशन होता है, और जब आप रिपीट करोगे, आप खुद लिख के देखोगे, तो आपका जो प्रेजेंटेशन स्किल है और जो रिटेंशन आपके दिमाग में होगा वो काफ़ी ज़्यादा होगा। तो जैसे जब भी मैं पढ़ाता हूँ, आप साथ साथ में, मेरे साथ साथ में आप भी उसको लिख के अगर प्रैक्टिस करो तो ये ज़्यादा बेनिफिशियल होगा आपके लिए भी। इज ऑल अबाउट द एंजाइम। थैंक यू ऑल ऑफ यू। एंजाइम पैटर्न इन लीवर डिसीजेस, मतलब ये तो पूरा एलएक्यू है, मतलब एलएफटी का पार्ट है। एसजीओटी, एसजीपीटी, अल्कलाइन फॉस्फेटेज, 5 प्राइम न्यूक्लियोटाइडेज, गामा ग्लूटामिल ट्रांसफरेज और एलडीएच, इसके बारे में डिस्कस करना है। ठीक है, तो दिस इज ऑल अबाउट द एंजाइम टॉपिक। थैंक यू ऑल ऑफ यू।